Attention, all Medicare recipients. All right. Open enrollment. It is underway. Once again, we know when fall hits, inevitably, it's that time. Now, maybe you've gone year after year with the same plan, but every year it's worth looking at your plan and saying, is this the plan for me? Our next guest can give you some great inside advice.
No question. Dr. Mark Perez is here with Optim Care Network of Nevada, here to clear up the air when it comes to Medicare. It's great to
Yeah.
have you, Doctor. How are you?
Good, very well. I'm doing very well. Thank you.
Let's talk about, first of all, Optim Care Network of Nevada, and tell us about the network and what it entails.
Well, the network has a whole group of different specialists which are well qualified and all board certified and a tremendous benefit as far as access. And I think that's the more important thing is people want to have access to the physician and to the specialists. And I think that's one of the best things we have with Optum Care, you know.
Yeah, that
Um,
is that is
mhm.
an that is an excellent bonus. Sorry to interrupt. I was just going to say we'd love to know a little bit more about you too, Doctor. Thank you for inviting us
Sure.
into your office today. We do know that your middle name is Anthony. We did learn that
Yeah.
before the interview. What else should people
Yes.
know about?
Well, I think you should know that I've been in practice over 30 years and been in the Las Vegas area for about going on 9 years. And I'm right behind Desert Springs Hospital. I'm like 100 yards away from the ER, which is really one of the best things that has been for my patients. If somebody gets really ill and we need to rush them over, I've actually wheeled them myself over to the emergency room because
Wow.
we're very, very close. So I think that's one of the things that's very, very accessible to us. Okay.
Mhm.
Second thing, I think that one of the things with my practice is that we're very compassionate and we really try to take care of the patient, have access to the patient, and treat them with respect. I'm bilingual. My staff is all bilingual, so that's a real important factor as well to do. But those are real important factors in dealing with the patient, especially listening to the patient. Really attention and listen to their needs. And it's just not just their ailment that's coming in, the abdominal pain or the muscle ache or their knee pain. It's taking into account the whole patient, their psychosocial needs. And that's so important.
Yeah.
Where do they live? Are they home? They live alone? Do they live with family? Those are all important factors. That someone has a knee surgery and do they have somebody to take care of them after the knee surgery? And all those are so important in taking care of the well-being of the patient.
Absolutely. It's a
Yes.
whole body approach, which I love. I know Optum Care, you provide senior care and primary care and family medicine, and you accept insurance plans, including Medicare and Medicare Advantage. Let's talk about Medicare. Annual enrollment happening right now.
Hmm.
And this is kind of a time where if you're on a plan, you got to make sure that the plan that you have hasn't changed. And if your life has changed, you got to make sure that the plan that you have is going to be good for that new plan. Let's
Right,
talk about Medicare
exactly.
enrollment.
Yeah, it's one of the things with Optum Care. It covers most of the medications. It has so many added benefits that some of the plans don't have. And I think it's very important to realize that these plans change. Their medications may change, that we're on formulary, they may not anymore. I know with certain senior plans that after a certain age, they have much higher copays on certain things. And so all of a sudden you may be wanting to get a treatment or get a medication and it's changed. It's not accessible and and it makes really a difference. And that's one of the best things about Optum Care. It's really well covered as far as the coverage specialists and procedures. Those are all important as well.
Yeah, that's excellent. And we understand your individual office is covered under Optum Care. It's great.
Correct.
And what is your specialty, doctor? You mentioned being very close to the ER, and
Hmm.
obviously you have a lot of senior patients. Do you
Right.
practice otherwise, like in family medicine or?
Yeah, my practice in family medicine. I'm board certified in family medicine. I actually worked 13 years of emergency medicine when I was in California, but I was board certified in family practice, and I much more prefer the family practice. And so we handle a whole variety of things in family practice. I do joint injections. I do a whole bunch of procedures. I do a lot of biopsies, and which a lot of physicians don't do that because if they're internal medicine, some of those doctors will refer a lot of things out. But I do most of those procedures in house myself. So
Awesome.
Yeah.
yes,
Doctor,
So, sir,
you moved here from California before it was cool.
right.
It's great to have you, my friend. We appreciate you
thank you
so
for
much, and we'll
joining
point
us.
people in the right direction.
Thank you very much.
All right. If you
Okay.
want to learn more about Optum Care Network of Nevada, you can just go to optumcare.com. Their number right there on your screen as well. They have locations throughout Southern Nevada. Optum Care Network of Nevada, a proud sponsor of the Morning Blend.